afternoon, everyone. Thank you for joining our research webinar. My name is Dova Levin, and I am the National Senior Director for Educational and Patient Programming. Today, we have Dr. Edmundson, who will be talking to us about targeted treatment for generalized myasthenia gravis. As we go through the presentation, please put your questions into the Q&A box, and we will get to as many of them as we can at the end of the session. Christyn Edmundson is a neuromuscular specialist living in Seattle, Washington, a graduate of Brown University and Albert Einstein College of Medicine. She completed her internship and neurology residency at the Hospital of the University of Pennsylvania from 2012 to 2016, where she was recognized with multiple teaching and clinical awards. She completed her neuromuscular medicine fellowship at Harvard Partners in 2016 and 2017 before returning to the Hospital of the University of Pennsylvania as an assistant professor of neurology from 2017 to 2021. In 2021, Dr. Edmundson moved with her family to Seattle, where she practices at Swedish Neuroscience Institute as the Director of Neuromuscular Medicine. Dr. Edmundson has particular clinical interest and expertise in autoimmune and hereditary neuromuscular disorders. She is also dedicated to medical education. In her time at the University of Pennsylvania, Dr. Edmundson served as the Director of the Neuromuscular Medicine Fellowship, Assistant Neurology Clerkship Director, and was involved in resident education. Her teaching efforts were recognized by induction as a faculty member of AOA in 2020. Since her move to Seattle, Dr. Edmundson has taken on the role of site director for the Neurology Clerkship at Swedish Neuroscience Institute. Dr. Edmundson has authored and co-authored multiple published articles and chapters. She frequently speaks at regional and national conferences, including AAN and AANEM annual meetings. We do want to thank our sponsors today, our national presenting sponsors, Alexion and Argenx, our national collaborator, Amgen, and our national sponsors, UCB and Johnson & Johnson. I am going to stop sharing my screen and allow Dr. Edmundson to share her screen.
Great. Let me put this up. Thank you everyone for being here. I really appreciate your time, and thank you so much, Dova, for that fantastic introduction. It looks like I can't share my screen. It has participant screen sharing disabled.
Hold on, I can help you. Hold on 1 second. Go ahead and try again.
There we go. All right. Perfect. And how does that look, Dova?
Perfect.
Great. All right. So thank you everyone for being here. It looks like we have a lot of participants. Some of you may know me from my clinical work, and some of you I may be seeing for the first time, but really appreciate you coming to learn more about this today. So I'm going to be speaking today on Zilbrysq or zilucoplan, which is a prescription medication that's used to treat adults who have something called generalized myasthenia gravis, which I'll call GMG for the rest of the talk, mostly just to spare myself stumbling over the phrase generalized myasthenia gravis. And it's specifically approved for patients who have acetylcholine receptor antibodies that are causing their generalized MG. And we'll talk more moving forward about what all of those terms mean. I want to be clear that it's not known whether Zilbrysq is safe or effective in children, so this is something specifically approved for adults. There's also some really important safety information which we're going to go over in detail. Zilbrysq is a medication that affects the immune system. It can lower the ability of the immune system to fight particular infections, particularly meningococcal infections. So patients who are considering treatment with Zilbrysq need to be vaccinated against Neisseria meningitidis. And there are also other types of infections that Zilbrysq may increase the risk of. There are some other potential adverse effects, which we'll go into again in more detail, which may include pancreatitis and pancreatic cysts. And then some more common side effects can include injection site reactions, upper respiratory tract infections, which some of us think of as being colds, and diarrhea. And that, of course, if you need any additional information, you can find safety information at www.zilbrisk.com. And it's important that before you make any decisions about your healthcare, you really need to talk to your own healthcare provider, your own doctor, about your medical care, in terms of, your background medications, other health conditions, and the status of your myasthenia. So Zilbrisk, or zilucoplan, is the first FDA-approved self-administered treatment for GMG, for patients with GMG who are acetylcholine receptor antibody positive. About Zilbrisk is that it's self-administered, so it can be injected yourself on a daily basis, either at home or if you're traveling, or elsewhere. So a quick overview of what we're going to talk about today. We'll talk a little bit more about generalized myasthenia gravis, what it is. We'll talk about how Zilbrisk works. We'll talk about some of the data that led to its approval, so what clinical trials showed us about how Zilbrisk works in myasthenia. And then we'll talk about how to use Zilbrisk, what functionally that looks like on a day-to-day basis. And then we'll also talk more about this REMS, which is a sort of a monitored prescribing program and vaccination requirements, as well as other potential adverse reactions from Zilbrisk. And then we'll also talk about Onward, the Onward program, which is sort of a support program that's offered by the company UCB that makes Zilbrisk. And then we'll wrap up with some discussion of how to talk to your doctor about your myasthenia and whether Zilbrisk is something that would be appropriate or beneficial for you. So starting by talking about generalized myasthenia gravis. So I want to start by defining a couple of terms here that many of you may be super familiar with and some of you may be hearing for the first time. So some important terms that are going to come up multiple times in this presentation and also on this slide is autoimmune disease. So an autoimmune disease is a group of conditions that are defined by your body's own immune system attacking another part of the body. So in the case of myasthenia gravis, the immune system attacks the connection between the nerve and the muscle, but other autoimmune diseases include things like rheumatoid arthritis, where the immune system attacks joints. So immune diseases are this sort of broad category of disorders. The immune system itself is a system that helps your body protect itself from infections and sometimes malignancy. So it's sort of a surveillance system where things that are recognized as being foreign are attacked and sort of decommissioned. And when your immune system is working properly, it goes after things like viruses, bacteria, fungi, and even cancers, things that could be threatening to the body. In autoimmune disease, the immune system misfires and goes after the body itself. And then the term chronic may not need as much explanation, but essentially means that a condition is long lasting. It's one that can cause symptoms over a long period of time. So it's just doesn't just happen once and then is done. And so myasthenia gravis is a chronic autoimmune disease. It's a potentially long-lasting disorder where the immune system attacks the connection, the signaling between nerves and muscles. And as a result, that causes muscle weakness because the nerves aren't able to signal properly to the muscles to contract to generate strength. Generalized myasthenia is a more severe form of MG, and I'll talk a little bit about what some of those symptoms look like. But in general, myasthenia is divided either into ocular myasthenia, where people only have symptoms in their eye muscles, or generalized MG, where they may have symptoms in their eyes and eye muscles, but can also have symptoms that affect, things like chewing, swallowing, breathing, arm and leg weakness. And as I had referred to already, GMG can affect muscles throughout the body. And one of the hallmarks of GMG is that weakness tends to be fatigable, meaning it gets worse with repeated effort. So people may have some weakness at baseline, but when you try and use your muscles or try and do things repeatedly, that weakness oftentimes gets worse. And this can be really debilitating. Both the weakness and also the sort of fatigue and fatigability component can make it really hard to do certain activities of daily living, which are the kinds of things your doctor may ask you about at your MG visit. So things like chewing, swallowing, breathing, using your arms to brush your teeth or comb your hair, using your legs to get out of a chair. And patients can also have, like I talked about, eye symptoms. So drooping eyelids or double vision, which can fluctuate, which makes it really hard. That sometimes there's double vision, sometimes there's not, sometimes it's better, sometimes it's worse. And the unpredictability is a real challenge. It's not always predictable when symptoms may be better and when they may be worse. So what causes GMG and its symptoms? So from the best of our understanding, GMG is caused by harmful antibodies in the immune system. And what is an antibody? So it's a part, our immune systems are really complex. There are a whole bunch of different parts. There's cells that are involved, there are antibodies, there's a complement system, there are lots of different pieces of it. And basically an antibody is almost like the foot soldier. It goes in and it attacks viruses, bacteria, et cetera. It sort of goes after the bad actors that the immune system is trying to protect the body against. And what happens in GMG is antibodies develop against certain proteins or certain parts of the connection between the nerve and muscle. So the antibody, instead of attacking, a bacteria or a virus, is actually attacking the place where the nerve and the muscle connect. And actually, people who have generalized MG or GMG have antibodies against this very specific thing, this acetylcholine receptor. And I'll talk a little bit about what the acetylcholine receptor is and how it plays a role. So some of you may have seen pictures like this before. For some of you, this may be your first time seeing a picture like this. On the top here is the nerve terminal, this blue structure. It's the end of a nerve that's kind of started up in the brain and then traveled through the spinal cord and out through the nerve in the limb or in the face. And then that nerve ends right next to a muscle. So on the top is a nerve where a signal is coming from the nervous system originating in the brain. And on the bottom is the muscle, which is where strength is actually generated from. So when a signal arrives to the end of the nerve here, it signals the release of a neurotransmitter, which is a chemical that signals information in the nervous system. So when a signal arrives to the nerve terminus, a neurotransmitter, in this case acetylcholine, is released, and that chemical signal sort of binds to receptors on the muscle, which then signal the muscle to contract. This entire structure together is called the neuromuscular junction. So it's the connection between the nerve, neuro, and muscle, muscular, so the neuromuscular junction. And it's obviously very important in signaling for muscles to work and for the body to work. Sorry, there we go. There. So what happens in generalized myasthenia gravis, or GMG, is these anti-AChR antibodies, or these acetylcholine receptor antibodies, they bind to the receptors on the muscle, and they get in the way of the signaling. So the signal gets to the nerve releases the neurotransmitter, the acetylcholine, but then when it tries to bind to the acetylcholine receptors, it either can't or does so in less optimal way because these antibodies are in the way. In addition to these antibodies sort of being in the way of the signal, once these antibodies bind, these acetylcholine receptor or AChR antibodies bind to their receptors on the muscle, which ends up breaking down this part of the muscle at the neuromuscular junction. And the way that these antibodies actually cause inflammation and cause damage to the muscle and the neuromuscular junction is through something called the complement system, which is a part of the immune system that sort of enhances the body's ability to protect against infection. So the complement system is non-cellular. They're not cells, but they're proteins that basically produce an attack of things that the body has identified are abnormal. So what you can see here is a representation of complement. So here we have antibodies that are binding to their target, in this case, the connection between the nerve and muscle, or the neuromuscular junction. And once that antibody is bound, it activates a complement protein called C5, which then directly causes damage to the muscle and also sort of recruits in other parts of the immune system to attack right at that spot that the antibody is bound. And it's not just the binding of the antibody to the receptor, but once the antibody binds, it activates this complement system, which then directly attacks and damages the connection between the nerve and muscle. And that over time limits the muscle's ability to receive signals from the nerve, and that causes the weakness and the fatigue that we see in myasthenia gravis. So in terms of how Zilbrysq works, so Zilbrysq targets a key cause of GMG symptoms. Specifically, it blocks the activation of C5. So you can see here is this bound antibody, which ordinarily would go and activate C5, which is then going to sort of cause a cascade of attack on the neuromuscular junction. What Zilbrysq does is it binds to C5 and blocks it from being activated. So the myasthenia antibodies are still there, but we're blocking this sort of key part of the immune reaction that actually produces damage to the neuromuscular junction. So by reducing this amount of muscle damage, by reducing the damage to the neuromuscular junction, Zilbrysq can actually help improve the signals between the nerve and muscle. So you can see here's a neuromuscular junction of someone with myasthenia without Zilbrysq. These antibodies are binding, they activate complement, and you end up with a lot of damage at the neuromuscular junction. In the presence of Zilbrysq, and again, this is a cartoon, the antibodies are still there, but the complement isn't being activated, so there's less damage to the muscle. There's less damage at the neuromuscular junction. So a little bit more about Zilbrysq. So Zilbrysq was studied in several clinical trials. The highest phase 1 is a phase 3 clinical trial that evaluated the efficacy or how well Zilbrysq works, specifically in adult patients with GMG, so generalized myasthenia, who had anti-acetylcholine receptor, anti-AChR antibodies. So people who met certain criteria in terms of how severe their myasthenia was and what parts of the body it was affecting, who were interested in being in the clinical trial, were divided into 2 groups. And these patients, for the most part, were already on other treatments for myasthenia. Then they were divided into 2 groups, and half of the patients were given Zilbrysq as a subcutaneous injection once a day, and half of the patients were given a placebo. So they were injecting themselves once a day with placebo, something that was not active or effective. And that was done for about 12 weeks. And then at the end of 12 weeks, they looked at the difference between the 2 groups, the patients who had gotten Zilbrysq and those who had gotten placebo. And then based on that, which I'll show you some of that information, assessed how well Zilbrysq works in reducing the symptoms of myasthenia. And actually 100% of the patients who entered the trial completed it, who completed it opted to take Zilbrysq long term. So at the end of the 12-week period where half of the patients got Zilbrysq and half of the patients got placebo, they had the option of enrolling in something called an extension study, where then everybody gets the drug. In this case, that 12-week randomized portion is finished. Everybody goes on to get the active drug. And what they saw in this phase 3 clinical trial was that Zilbrysq significantly improved the activities of daily living, and patients had fewer symptoms for myasthenia as measured by this MGDL score than patients who didn't get Zilbrysq. So the placebo patients didn't have as much improvement as the patients who did get Zilbrysq. Now, in any trial, there can be some placebo effect, and there certainly was in this case, where even patients who got placebo did better, but the patients who got Zilbrysq did significantly better than the patients who got placebo. The study showed that Zilbrysq produced a pretty rapid response. So the were obviously seen at the end of the 12-week study, but there were patients who saw in some patients, not everybody, but some patients saw improvements as early as week 1. I talked a little bit about this already, that these results were measured using the MG-ADL score, which is something that participants could score themselves on, and usually by sort of discussing with the doctor what kinds of symptoms they're having and how frequently they're having the symptoms. The MG-ADL score is measured from 0 to 24. 24 is the worst score you can have, and 0 is the best, with 0 meaning there are essentially no symptoms from GMG. Again, looking at some more of the outcome data from this trial, more than 7 in 10 participants responded to treatment. So among the patients who got Zilbrysq during that placebo-controlled portion, 73% of them saw a response in their MG symptoms. A response was defined as having 3 or more point reduction in that MG-ADL score. So if someone had 1 point or 2 point reduction, that's great, but it wasn't considered a true response. It could have been like an early response, but the threshold for considering a response to the medication was an MG-ADL score reduction of 3, and more than 7 in 10 folks who got Zilbrysq had a response at that level or better. And then nearly 6 out of 10 participants saw improvement in muscle strength. So about 58% of people who were treated with Zilbrysq had a reduction in their muscle weakness as measured by sort of an examination by a doctor who was participating in the trial. So this shows that people who received Zilbrysq in the trial both experienced an improvement in their symptoms that they reported, and also when they were examined by a physician had less weakness. And again, not everybody responded, right? But large proportions did, with 73% responding based on the MG-ADL score and 58% based on the QMG score, which is a physician-measured examination. In terms of side effects, this is a list of side effects that were experienced by more than 5% of people who were taking Zilbrysq, and they were experienced more frequently in people on Zilbrysq than in the placebo group. So injection site reaction was a big one here. About 30% of patients who received Zilbrysq had an injection site reaction, compared with 16% of patients who are getting placebo, which again is a subcutaneous injection of basically an inactive agent that doesn't work like Zilbrysq does. There were more frequent respiratory tract infections in the Zilbrysq group versus the placebo group, and also higher rates of things like diarrhea, urinary tract infections, nausea or vomiting, and then there were increased levels of lipase and amylase. Lipase and amylase are enzymes that are sort of made by the pancreas, and seeing high levels of amylase or lipase can indicate early pancreatic irritation or injury. And there were slightly increased levels of amylase and lipase seen in patients who were given Zilbrysq compared with placebo, where that wasn't really seen. And this is something that your doctor would typically check for before you start Zilbrysq. It's recommended that the amylase and lipase levels be checked before starting Zilbrysq, so you know if that's an issue already or not. So some additional safety information, as I'd mentioned a little bit earlier, Zilbrysq can increase the chance of getting serious or life-threatening meningococcal infection. Meningococcus is a bacteria that causes meningitis, and there are lots of different things that can cause meningitis, but meningococcus is one of them. And because of the way that Zilbrysq affects the immune system, it makes the body more susceptible to particular infections, specifically meningococcus. And it's because meningococcus is encapsulated. It has this sort of protective wall. The bacteria has this protective wall around it. And the complement system is really, really important in sort of punching through that bacterial wall to fight off the bacteria. So patients who are on Zilbrysq or other complement inhibitors are at higher risk of meningococcal infection and must be vaccinated against meningococcus. So patients need to be vaccinated before they start Zilbrysq, and you also need to get boosters periodically. So it's sort of, there's an initial series of vaccinations, and then your doctor will sort of monitor how long it's been since you've been vaccinated, and you need to get periodic boosters for as long as you're still on Zilbrysq. Zilbrysq can also increase the risk of other types of serious infections, such as Streptococcus pneumoniae or Haemophilus influenza B, or Hib. These are both also encapsulated bacteria. Not everyone, but certain people may need to be vaccinated against these bacteria before getting Zilbrysq or during treatment with Zilbrysq. And then certain people may have an increased risk of gonorrhea infection, which is also caused by an encapsulated bacteria. So you would want to be sure to talk to your doctor about whether you're at risk for gonorrhea and gonorrhea prevention and testing if you're taking Zilbrysq. And then pancreatitis and pancreatic cysts have happened in people who use Zilbrysq. As I'd mentioned before, your doctor will typically test you for certain pancreatic enzymes before starting Zilbrysq. I did mention on the previous slide that injection site reactions are more common in patients who got Zilbrysq than who got placebo, but none of the participants in this trial that we're discussing actually stopped their Zilbrysq treatment because of injection site reactions. So in terms of how to use Zilbrysq, so as I had mentioned right at the beginning of the program, one of the things that makes Zilbrysq unique at this point is that it's self-administered. It's something that people can give to themselves. You don't have to go into a doctor's office or go to an infusion center or have a nurse come to your home to give it to you. It's something that you can give to yourself. So it comes in a portable, ready-to-use pre-filled syringe. So you don't draw the medication up. It comes as these syringes that you give to yourself. And you give it to yourself or have a family member administer it once a day via a subcutaneous injection, which means it's sort of given under the skin. And this is something that you'd be trained in before administering. So ensuring that you know how to give it to yourself properly. It's dosed depending on your weight. There are kind of 3 different doses that the pre-filled syringes come in, and the dose that's prescribed to you is based on your weight as measured by your doctor. And this is a fun fact, Zilbrysq is self-administered and can be injected in about the same time that it's taken me to read this sentence. Once you or a family member or friend or caregiver is properly trained, you don't need to go to an infusion center or doctor's office to get Zilbrysq. And it can actually be stored at room temperature. So while it's held in the pharmacy, they keep it cool, but then once it's been dispensed to you, it can stay at room temperature in it for up to 3 months. So it's something that you could, if you're going to go and travel somewhere for a month, you can take it with you and you don't have to keep it in a cooler or keep it in a refrigerator, which allows for some flexibility. When patients in this clinical trial were asked, more than 8 out of 10 people said they felt confident in administering Zilbrysq. So it's something that people felt pretty confident that they were able to learn how to do themselves. In terms of REMS and vaccination requirements, so as I've mentioned before, Zilbrysq affects the immune system and can impact your ability to fight certain types of infections. Specifically, it can increase the risk of getting serious life-threatening infections from meningococcus. And because of this, Zilbrysq is given through something called a REMS program, which stands for a Risk Evaluation and Mitigation Strategy, which means that before a doctor can prescribe Zilbrysq, they have to go through training on how Zilbrysq works and how it increases the risk of meningococcus. And then before starting treatment with Zilbrysq, you need to get vaccinations against meningococcus to reduce the risk of getting a meningococcal infection. If you've had meningococcal infections in the past, your doctor may ask you to get revaccinated before starting Zilbrysq. And then for as long as you are on Zilbrysq, you're going to need to sort of be monitored and get booster doses of the meningococcal vaccinations periodically. Obviously, before starting this is something that you want to talk with in a lot of detail with your doctor to be sure that you sort of understand the schedule and the need for vaccination. So Panther RX is the pharmacy that actually dispenses Zilbrysq, and they will also help with monitoring, making sure that you're getting the required vaccination and working with your doctor if you're like due for a booster to make sure that you're getting your meningococcal booster before you get before the medication is dispensed. Panther RX, it's sort of the only pharmacy that actually dispenses Zilbrysq, and it's sort of they've concentrated all of that in one place. in some ways to make it easier so that they can monitor different aspects of treatment and make sure that you're getting the vaccines that you need. And then, as I said, they sometimes will even interface with the doctor's office to ensure that if you're due for a vaccine, that your doctor is writing for that. So before you can receive Zilbrysq, your doctor needs to do certain things. They need to talk to you about the risk of meningococcal infection. They need to make sure that you've completed your meningococcal vaccinations at least 2 weeks before your first dose of Zilbrysq. And they also, there are rare cases where a doctor may really want to start Zilbrysq like right away and not wait the 2 months or so that it takes to complete the meningococcal vaccination series. If that happens, your doctor may decide to start Zilbrysq right away, but also give you antibiotics to reduce the chances of getting a meningococcal infection. It's also really important to know about the symptoms of meningococcal infection when you're on Zilbrysq. This includes things like headache and fever, nausea or vomiting, stiff neck, rash, confusion, muscle aches, and flu-like symptoms. And your doctor will actually give you a card, or Panther RX may give you a card to carry with you that has a list of the symptoms of meningococcal infection, so that if you have any early symptoms of a meningococcal infection, you can reach out to your doctor right away and get appropriate treatment for that. So the patient safety card is something that you should keep with you. It's really helpful. So especially if you're interacting with someone else in the healthcare system, another doctor or a nurse or a provider who isn't familiar with Zilbrysq and the risks, you can also show that to them so that they understand that you're at increased risk for meningococcus. Lastly, I'll talk just a little bit about the Onward program, which is it's a personalized program that's designed to support patients with GMG who are getting Zilbrysq. It's created with the idea of helping rare disease patients and healthcare providers. And once you get your Zilbrysq prescription, you can begin getting support at various steps. So once your doctor has written a prescription for Zilbrysq, they can help you with things like getting vaccinated. There's a care coordinator that would be individually assigned to you. There are different tools and resources that can help you get started and continue on your prescribed treatment. They can help with things like financial assistance or even tracking the symptoms of your GMG. So in terms of talking to your doctor, there are some questions that that might be worth bringing up with your doctor if Zilbrysq is something that you're interested in. You would want to ask them about what kinds of GMG symptoms you might have even if you're on treatment, what you should consider before starting a treatment like Zilbrysq, how to know if Zilbrysq is the right treatment for you or if it's working for you, what to expect when you're giving yourself Zilbrysq, what you need to know about meningococcal infections, and of course, as we've talked about a couple times already, the need for vaccination while getting Zilbrysq, vaccination against meningococcus. So in summary, Zilbrysq is a treatment that's been shown in clinical trials to significantly improve GMG symptoms. In some patients, it provides a rapid improvement in their ability to do activities of daily living, with an improvement in symptoms seen as early as a week after starting the therapy. It allows you to take some of your treatment into your hands by self-injecting once a day, rather than relying on going to an infusion center or doctor's office or having a nurse come to your house to infuse a medication for you. And then important common side effects. The most common side effects include injection site reactions, upper respiratory tract infections, and diarrhea. And then, of course, as we've talked about multiple times, really important to know about the risk of meningococcal infection, to know that you need to be vaccinated against meningococcus, and to know that you may remain at risk for meningococcal infection. So important to know about those signs and symptoms of meningococcus before starting Zilbrysq. Of course, as I'd mentioned before, in some cases, a doctor might want to start Zilbrysq sooner and might consider treating you with antibiotics until 2 weeks after you've finished your vaccination with Zilbrysq. And if you do develop a meningococcal infection, you would need to stop Zilbrysq and seek care for that and have your doctor treat you with antibiotics. Other safety information, which we've gone over, but just to reiterate, you should call your doctor with any of these signs and symptoms of meningococcal infection, including headache with nausea or vomiting, headache with fever, headache with a stiff neck or back, fever and rash, confusion, muscle aches or flu-like symptoms, or sensitivity to light. And you should carry a patient safety card about the risk of meningococcal information with you. In terms of some other safety information, as I'd mentioned before, your doctor has to prescribe Zilbrysq through this REMS program that they enroll in. They have to counsel you about the risk of meningococcal infection, give you a patient safety card, make sure you stay up to date on your vaccines, and then also ensure that if you need, you may be vaccinated against these other types of infection. And then if it's an issue, talking about the risk of gonorrhea. So important the sort of finishing up with the important safety information in terms of things like breastfeeding or pregnancy. Zilbrysq has not been studied in patients who are pregnant or breastfeeding. So you would want to be sure to talk to your doctor if you are pregnant or plan to become pregnant. It's not known if or how Zilbrysq could affect an unborn baby. And if you're breastfeeding or plan to breastfeed, we actually don't know if Zilbrysq passes into breast milk. So that's something that's really important to discuss with your doctor up front. And then, of course, as with any medication that you're starting, if you're going to be starting any medications, including prescription or over-the-counter medications, you want to tell your doctor about them before starting Zilbrysq, so your doctor knows what other medications you're on before starting this treatment. And we've talked about these possible side effects. We talked about pancreatitis or other pancreatic problems. So if you develop symptoms like pain in the stomach that doesn't go away, your doctor may tell you to stop using Zilbrysq. That can happen with or without vomiting. These could be symptoms of pancreatitis. So if you develop something like abdominal pain, vomiting, etc., really important to let your doctor know. Again, the most common side effects with Zilbrysq are less severe reactions like injection site reactions, upper respiratory tract infections, and diarrhea. And then including boxed warnings, you would want to go through this information all in detail with your doctor before starting Zilbrysq, review the prescribing information before starting any medication. Thank you so much for joining me today.
Well, we thank you, Dr. Edmundson, so much for this very informative talk. We are recording it, and hopefully soon will be on our website for everyone to either rewatch or for new people to see. So we really appreciate your time today.
Absolutely.
Thank you
so much.
All right. Have a good day, everyone.